not to get off topic, but a large part of what I do, why I do, is my father was a victim of all that, and he ended up disabled in his 30s from a real barbaric surgery they did to him. And I watched them,
Are
and
you talking wheelchair?
I mean, he was in the hospital for 8 months after the surgery, never came out. So, and massive screws, bolts, but and then just numerous failed back surgeries, and then the whole pharmaceutical onslaught that ensued and kind of took his life from him. Which fortunately he was able to overcome a good deal of it. But watching it as a child, it was and my empathic nature and just wanting to help and heal, that kind of made me realize there has to be a better way. But what's happening is if you go into the area of the spine and cut out an area, okay, fine. That problem isn't coming from where you just cut it out. So you have to treat the entire person. So what I explain to my patients who may have had a surgery, or if I will actually send patients for surgery. I mean, there's some patients where it's too far gone and the cost benefit is now weighing in favor of surgery. So I'm not saying that there's never a time or a place. You just want it to be the last resort. Everyone's always looking for like this term biohacking you're hearing all the time. Like, why would you hack your biology? Why not balance it, right? Like if I said, oh, I got this like great hack mechanic, he's like great at car hacking. Like, would you want a hack job done, or would you want the car like fixed completely? So and I'm sure you've heard it like, oh, this is biohacking. Like, well, if you're doing everything right, you don't have to hack your biology. You can normalize it and balance it. But I tell patients I don't use so much pressure, because there is a level of pressure that's therapeutic just for bone density, right? So jumping jacks, different things like osteoblast activity is increased with pressure. Sustained pressure, not necessarily, but activation of those tissues. I mean, we need to hit stuff. We need to jump down from a step, activate the bone matrix. So, but that repetitive, isolated motion with constant pressure, yeah, it breaks things down. People think it's like a cold, right? Like, oh, I caught arthritis. Like, I got arthritis, and it's like, it's not like this pathogenic thing. It's a functional issue. It's a result of friction. When joints move freely, they're fine. When joints start jamming and moving and grinding, friction happens, and that osteoblastic activity that I just referred to starts to increase because the body has to protect that area from, and the way I explain it is like, if you got calluses on your hands from lifting, which I certainly do, the reason it's dysplasia, right? Like this tissue type has to change to accommodate the stress you're putting on it. So do you really want to go and start jamming the cartilage in your knee with heavy weight? At some point, that's going to change. It's going to stiffen. It's going to become more rigid to endure all the pressure you're putting on it. I don't understand. Not being active is that blows my mind. I can't really think of. I almost think about it like it's a mental illness, like it should be diagnosed and classified. That you don't, because that means you just don't like to feel good. Like the reward, the psychological benefit. Forget aesthetics. Like you're a better person for everyone else when you're active. You're a better father. You're a better husband. You're a better, brother. Just neurologically, what it's doing for you being active.
Welcome aboard, everyone. I'm Sifu Slim, and I am in West Palm Beach, Florida. Had a nice decompression exercise program this morning using massage techniques, stretching techniques, and hanging bar exercises, and then some yoga type positions, including the pigeon, and then the side plank with some, side abdominal area exercises. Some walking. I'm not doing a lot of impact running these days. I couldn't ski this year, and my chiropractor says, why don't you just retire from skiing and make your life easier on your joints? And I said, would that be sensible? Because I've been a sensible person for the most part, maybe 85% of my life, which is probably high on the sensibility among athletes. And she said, yeah, why don't you just retire? So over to Dr. Adam for some of his thoughts on lumbar, what he's going through. Maybe first tell us who you are and where you are, and then we can go into some of the lumbar stuff.
Sure, gladly. My name is Dr. Adam Massoud. I'm a chiropractic physician in Greenwich, Connecticut. Greenwich Wellness is the practice I've run for about 20 years. I have a background in sports medicine, graduate work in nutrition. I'm also an acupuncturist. So, done a variety of different things. The path that led me there is probably its own uh, podcast. So, that's what I'm currently doing. I work with a lot of athletes. Due to the nature of my demographic, we do a lot of work with just internal medicine. I don't know if it's become my shtick, but it's my passion is ending the sick care model. Um, if you know why things are the way they are, then you can't really be okay with that. And there's better answers. So, that's I've kind of dedicated my life to getting people liberated from the sick care system and getting well. Not to say there's never a time or a place for, medicine and surgical interventions, but it's certainly not health. There's a difference. So yeah,
So,
that's where I'm at.
so when we started off today, I said, Dr. Adam, can you guess why I'm standing today instead of sitting? And what was your answer?
I said your low back hurts.
Yeah. And so about the same time last year, I was in Savannah, Georgia, talking remotely via Zoom for an interview with my tennis coach, who's an MD and a PhD, and he's younger than I am by maybe 15 years. And right during our interview, because I was sitting, I got a cramp in my hamstring and on the inside of both of my legs at the same time. So I sprung up, knocked my computer and lighting system all over the place, and I'm screaming. And the
Of
audio I could
course.
still hear. And he said, "Do you have any coconut water?" And so leaning over, I made my way to the refrigerator and I did have some of the really good coconut water. And I probably was in need of electrolytes, but I also have some pinched nerves, which, even though if you do electrolytes properly, you can still have claudication and cramps from the pinched nerve and the foraminal stenosis. But I made it over the refrigerator and I gulped down almost more than half of a good sized carton of the coconut water. And then through some stretching, I was able to get back and, alleviate the cramps and continue the rest of the interview. Over Dr. Adam for his thoughts.
Yeah, I mean, certainly electrolytes. A big thing with like what you're talking about, that neurogenic claudication, paresthesia, vascular compromise is, you know, depending the long standing, if there was a long standing nature of your injury. Another thing real important in that aspect is really understanding the B vitamins. So electrolytes certainly in a, they're very important, but when you're having that intervertebral foramen stenosis, and the big things, your B6, B12, making sure those paresthesias keep going. But obviously once you added in the rigorous exercise and the sweating, then well, it makes sense, right? Because your B vitamins, some of them are water soluble. So as you were also sweating, B vitamins and the electrolytes are what you're losing. So
So Dr. Adam, when you have the neurogenic claudication based on you know, a, a nerve being pinched and the spinal fluid not going down and bathing the nerves where you need that to flow, um, all of the proper supplementation and anything else that you can do handling wellness, that can't necessarily stop that neurogenic claudication if it's an impingement on that nerve. Is that correct?
The level which we can compensate and make things happen is pretty crazy. I've seen some imaging on patients where it's like, wow, how do you feel your foot? And they're like, oh, I'm running, and then yeah, I've seen imaging on patients or just actual functional orthopedic neurological screening, physically done in the office where uh you're like, you know, you're pretty good, and they're talking about like they're in excruciating pain. So yeah, individual to individual, certainly when it comes to nerve compromise and nerve stuff, but uh, those metabolic factors that you're talking about causing the neurogenic imbalance, which are giving you that claudication, paresthesia, possibly a fasciculation. Those are there. Certainly, there needs to be a mechanical introduction to resolve the problem. A lot of times people think it's as simple as just, well, you have a bone on a nerve, and and Sifu, I'm not sure if you've heard, that presented to you and told that way. And that can certainly be the case. It's usually not that simple. You can also have what is called a chemical radiculitis. So in that situation, you have basically just all the bradykinins, prostaglandins, the metabolites in the area are kind of soaking. They're bathing that nerve, right? So it's almost like there's so much fluid and inflammation in the joint, the nerve is actually compressed by the fluid, and that would be your chemical
Wow.
radiculitis. So, and then obviously there's the mechanical, which could be the stenotic intervertebral foramen, where you're getting hypertrophy of the joint from friction, which is what we refer to as osteoarthritis, which is what a lot of drugstores sell things for, and but not necessarily cure.
Dr. Adam, I'm fascinated by the way you put your sentences and thoughts together. You speak as though you were a research scientist, the way you put these terms together. Did it take you a while after chiropractic school to be able to do what you're doing verbally right now?
Nah, that's thank you. I appreciate that. It didn't. My background in physical therapy and sports medicine. While I was doing that, I also did research. I got really into research. It's funny you say that. I really enjoyed it. I did a couple of research projects with the dean of the School of Health Related Professions where I was, and um, it was a research intensive university. So I think maybe you know what you're taught, and to me it was to be brash about it. There's a lot of let's just call it what it is, propaganda, bad talk about certain things. When they kind of talk about alternative health, I get really frustrated with that. It's either healthcare or sick care. It's either healthcare or medicine. Medicine is the alternative to health. So like, but they're like, well, that's alternative care. It's like, no, that's healthcare. You're the alternative, and you've been the mainstay for the last 75 years, and we're sicker than we've ever been. Well, actually, the last 100 years, but that's another conversation. So to me, it was information is liberating, and if you can retain your information, and the difference what makes a good doctor, in my opinion, and a bad doctor, or a competent doctor. I don't want to say bad because that implies some nefarious intention or something, but what makes a good doctor is a doctor who can take all the sciences they've learned, apply them, and figure out and pinpoint what's going on with the patient. So if you can't take the science you've learned and use it in an applicable way, you're limited. And a lot of physicians are really good at memorization, regurgitation, but they can't necessarily tell you why what's happening is happening with the patient. So to me, it was absorb the information. And then when I'm telling you scientifically what's transpiring, it's kind of irrefutable until the science shows otherwise, which obviously science is questioning. And some of these things like neuroscience, biomechanics, biochemistry, they're, that's pretty established. I mean, if there's some major breakthroughs, fantastic.
The way I look at that question is there was a movement somewhere in the early part of the 20th century and enhanced in the mid and latter part of the 20th century to use this word alternative, as if human beings for upright walking entities for millions of years didn't know how to provide wellness with roots, with postures, with
Right,
water, with rest.
right,
One of the stories I use, if you think of the 1800s and the cattle drives from Texas to the Chicago area and the meatpacking plants, if you're on a horse for a month or 2 months or whatever it was, you're going to have to figure out some stretching, some hanging, have a person come down and say, hey, can you press me here? You're a bunch of guys, eating beans and drinking coffee, and you're on a horse all day, and you
hmm,
might be leaning down in a funny posture while you're stiff. So if you're 28 and you've been doing that since you were 10, think of the ease of injuring yourself or pulling a muscle and those types of things. So my thought is that these people had to learn, whether there's a fence nearby or a stump or a rock, to go up and stretch and
yeah,
to find a tree branch and to go up and hang. Otherwise, they can't keep their job for a month and a half, 2 months on the cattle drive. And alcohol, you can't do enough to alleviate the pain and to stay functional for
right.
an 8 to 12 to 15-hour day, keeping the wolves away from the herd and maybe the Native Americans away from your herd or rustlers. So you really had to learn biomechanical therapy, wellness therapy by default in times where there weren't surgery centers and clinics around. Over to you, Dr. Adam.
Absolutely. I mean, if you, I mean, we could go beyond that into just like, bone setting that goes back thousands of years. So the concept of the body applying hands to the body and getting the body free from interference is not something chiropractic, as that's one of the major things I do. We love to take pride in the specificity and the analysis and assessment and diagnosis of spinal malfunction. But we're not certainly the first to address the fact that you have to, Hippocrates said, look to the spine for the root of all disease, right? The father of medicine. He must have been a real alternative guy, according to his current, his people coming after. So, because, why would he say that? Because it's true. So, yeah. So if you go back, even like the Turkish Empire, there was bone setting going on there, and Chinese medicine, traditional Chinese medicine, which I also practice, goes back 5,000 years. Uh, I don't know that we're the most advanced society. So we're the most technologically advanced, but as people living functional, healthy lives, we've kind of, as a society, at least in Western, we're out of touch with the things that kept us going for thousands of years.
And we're sold that the expensive healthcare system and the fancy offices we've seen
Right.
in America for our dentists, for our physical therapists, for our doctors, we're taught that that's the elite. And we pay elite prices for the medicine we receive and the treatments we receive in the United States. The rent is higher. The chiropractic tables are expensive. The flexion distraction tables, the fancy ones, could be $50,000 to $80,000 unless you're buying them in bulk and you've got this huge clinic. But these things are so expensive. But I can remember 2 years ago getting some dentistry done down in Tijuana across the border
Oh,
from San Diego. And I got a major amount of my teeth resurfaced. And the price tag over 4 days was $1,600. That would have been 2 hours in the United States. And I figured out that it was roughly 13-14% of the cost it would have cost me in the United States in Tijuana. And I mentioned it
wow.
to a lot of people, and they wanted the address. I mentioned it to my tennis instructor, and he goes, "Oh boy, you're doing yourself a disservice by going across the
Yeah,
border
yeah, yeah.
for medicine." Where's this coming from in 2024, 2023, for people to
Right.
think that college graduates in a foreign country have spent their a better part of 15 years studying biology and chemistry and then medicine and dentistry are somehow deficient and not up to speed with American people who've gone to a
Right.
famous dental school in the United States. Where's that coming from?
Well, it's coming from, well, indoctrination,
Propaganda.
really.
Yeah, indoctrination,
It's
propaganda.
it's like what happens. You cross the border, and all of a sudden, like, there's no electricity, there's no books, there's nothing. It ends like just that imaginary line that they drew. Kind of, the information can't cross that line, so only people, right? So it's pretty funny. I definitely hear what you're saying, and I've had some patients with certain ailments who I myself haven't been down to Mexico for these, but I've, through other colleagues, known of certain treatments in Mexico where I've, given my patients the information to go and do.
There, what I was told a number of years ago, that there are somewhere in the order of 3,000 dentists in Tijuana. And there's also surgery centers, physical therapy, all kinds of things, alternative healing centers down there. And there's
Mhm.
all kinds of stuff around the world. Mexico is one that happens to be close, but guess who those people in Tijuana are servicing?
Us.
Yeah, Americans and Canadians.
Yeah. Yeah.
Canadians have cheaper medicine, but they can't get in to see them at all times. So they can
Right.
fly to Tijuana or to San Diego and do their thing down there. And it's called medical tourism, dental tourism, and
Mm.
that's been filling a niche. If I had the choice between $150,000 back surgery from a famous person with a YouTube following in the United States,
Yeah.
and somebody who's the same skill level in the same surgery center for 70,000, and those are the numbers that were given to me as recently as 2 months ago for a spinal surgery with a cage and fusion and laminectomy. It's about
Oh
half
wow,
the
so they want to, that's a whole rehaul.
a whole rehaul, and it's half the price down in Mexico with someone who did 2 years at a surgery center in a major university town in America. So, and he speaks perfect English because he went to bilingual schools, and he's dedicated his life to surgery. And which one would I choose if I had to pay out of pocket? You know, if money was an issue and I thought they were both on the same level, I would pick the one that was half the price down in Mexico.
That's a sensible take on it for sure.
Guess why I haven't done the surgery, Dr. Adam?
Because you're trying to get better without it, or you,
Because it's very likely that the surgery is not going to work.
well, right. There's no guarantee, right? I mean, for there's a time and a place for sure, but if you can, go at it yourself and try to do all the right things, and it sounds like you have a pretty good understanding of what is going on with your condition, and you're doing a lot of the right things. So I hope that resolves for you
Oh,
soon. I've certainly
if
dealt with it myself, and it's no fun.
what if you had to look and you listen to your colleagues who are talking about their case studies, the people who've done a major surgery like the ones I was talking about in their 60s, like I am. What age are you currently, Dr. Adam?
46.
Okay, you're the same age as my tennis pro who's a doctor, but he's not the one who mentioned the bad outcomes of dentistry in Mexico. That was a different tennis coach. But
That's-
anyway,
yeah,
but if you had to look, let's say people your age and my age that have done these major surgeries in their 40s through 60s, like I am, and did all the pre-op and the post-op correctly, and
right,
then did all of their maintenance and their ongoing physical therapy and their chiropractic appointments and their hanging and their decompression and in low inflammatory diet, all the best beds, the right
right,
way to do sleep. They did
right.
all the right things and didn't sit all the time. And you looked at their lives over the next 5 years, 10 years, and you saw the rate of people who needed to go back in to replace screws in their bridge in their cage, and had other uh, problems of dysfunction in the post surgery. What
Right.
would you say the ratios are, anecdotally speaking, or if you happen to know what the research is showing? Share some of your thoughts on that.
Hi, this is Sifu Slim, author of The Aging Athlete. In this book, you're going to get to hear about two different groups of former high-performance athletes. One group, which is made up of 90% of the former athletes, does not do physical activity on a regular basis and tends to suffer the consequences of a sedentary lifestyle. The other group, which is made up of 10% of the former athletes, is doing physical activity on a regular basis and tends to thrive through the aging process, or at least has a better chance at coping with the aging process. We could have taken these folks to a lab and done all kinds of tests on them. Instead, we slowed them down and sat them down and asked them, in their own words, to describe why they're wired the way they are, so that we all, former athletes and non-athletes, can use some of their inspirational and motivational and mindset lessons in our own lives. I hope you pick up a copy today. You can go to theagingathlete.com, and when you have a chance to read it, I'd love to hear back from you to find out what your thoughts are on the stories of these aging athletes.
I think last I did have some numbers, but this is going back probably a decade, but that 40% of people with back surgery will have more than one. So, and I'll speak on that in just a second as to why that's the case, and you probably can infer that yourself as well. So that's the thing. And with patients I've had who had those severe uh, rehauls, like you're saying. Now, I'm not a surgeon, so I can't speak on different surgeries and their outcome or their. Like you said, I can speak anecdotally. I could speak based on the data, but I couldn't tell you what surgery is right for each individual. That's not what I do. So, like a micro discectomy, which it sounds like they're not proposing for you, is I've seen fairly good outcomes with micro discectomy, which is where they kind of go in, and they just shave the corner of the disc. It's a minimal incision in and out. the laminectomy, cage overhaul, that kind of stuff you're talking about.
Long screws that show up and
Well,
set
first
off
and
the alarms at
foremost,
the airport.
right. So, not to get off topic, but a large part of what I do, why I do, is my father was a victim of all that, and he ended up disabled in his 30s from a real barbaric surgery they did to him. And I watched them,
Are
and
you talking wheelchair?
I mean, he was in the hospital for 8 months after the surgery, never came out. So, and massive screws, bolts, but and then just numerous failed back surgeries, and then the whole pharmaceutical onslaught that ensued and kind of took his life from him, which fortunately he was able to overcome a good deal of it. But watching it as a child, it was and my empathic nature and just wanting to help and heal, that kind of made me realize there has to be a better way. Every new specialist was like, well, we'll cut you, we'll cut you, we'll cut you. And so the reason I say that is so you can understand how passionate and very close to me the situation is you're asking. So I could just go based off my entire existence.
What years
But
was he getting that surgery?
what's that? I'm sorry.
What years was he involved in that
This
surgery?
would have been mid to late 90s. Mid to late 90s. And the surgery, it's a long story, but they did an unapproved FDA surgery on him. They were experimenting on him. He went in for one procedure. They did a totally different one. It was gross malpractice.
Wow.
And
Wow.
then, he had to go to like other parts of the country because no one would touch him because he was so compromised and was like, what did they do to you? So it went on for a very long time. But to say that, so I have one of the most extreme cases I've ever seen very close to me. When I take other extreme cases that I've dealt with, like you're talking about, that I don't see fantastic uh,
Outcomes.
outcomes. But they're not to say, listen, if a person's losing bowel or bladder function, they got foot drop, nerve damage. I mean, surgical intervention is surgical intervention. If a patient is in some moderate to severe back pain, and the surgeon can kind of say, well, you got multiple levels degenerated, you got some facet hypertrophy, you got some pedicle weakness, you got all the, and then they, well, we're going to do the cage resect. uh that's tough. I have a guy who very recently he came in, he had a cage, three different areas caged. And it's weird because he has a really bad scoliosis that he didn't know he had until he was like in his, I would say maybe 40s, which is kind of crazy, but that shows how little we pay attention to the spine in the West, right? You could have like, but you're taught from a very early age to brush your teeth and dental hygiene, and which is also very important. But we don't understand that your entire central nervous system is running through your spine. That is the system that controls everything. You can't replace it. There's no brain and spinal cord transplant that I know of yet. There's no spine transplant, right? We can change heart, kidney, liver, right? But we can't change your central nervous system, and you can't live 3 seconds without it. And the more you treat it, the more free you are from a lot of different things. So, but it's just, so that kind of surprised me that he went that long without knowing he had an issue, and that that awareness should be raised. So, but now I think what they want to do, he came in, we had him moving, he was doing really well. He actually came in like I was surprised he couldn't even really walk coming in, and within about 3 weeks he came in after one weekend and told me he went skiing and that he split a bunch of firewood, which I was like, that's probably not a good idea. But I was so happy that he felt good enough to do. When people start to feel like they get action back, they want to take action. So he went and did that. And but unfortunately, now I think I hadn't seen him for a while, and he followed up with me, and I think they want to go in and they want to fuse and cage 11 vertebra in his spine. They said, and if it gives him comfort and allows him to be pain free, and then I think well, I don't know if he'll be pain free, but to reduce the pain he has, then that's great. I can't imagine what he will be able to do and not do after that. And I've seen a lot of patients who've had surgeries. Unfortunately, the work I do is not where a lot of people start. It depends on your pocket, depends on your demographic. I don't want to get into the whole socioeconomic and, thing, but it does depend. So, usually by the time a patient comes to me, it's either someone's told them you have to go there or everyone else has failed, because the television usually just tells you to call your doctor and ask for this drug. So, the television doesn't say like, hey, your nervous system's interfered with it, and if you go clear it out, you can live your life. Because you can't patent your nervous system, so why would they even talk about it? They can patent the thing on the television, tell you to go ask your doctor for it. So that's usually where they're starting. So by the time they come to me, I've already seen the failure. And then it's like, all right, well, let's restore your life. Let's get you going. I've had patients come in and say, well, I'm going to opt for the surgery. And then about 8 months later, they're back in. And, so I think a
What does that
disservice
mean,
or,
man? Let me
yeah,
interrupt you for 1 second. You said they're back in. You mean 8 months later they're back in for another surgery?
they're back in pain, they're going back to physical therapy route or whatever, and then they're back in. Yeah, because I'm being long-winded, I apologize, Sifu, but what's happening is if you go into the area of the spine and cut out an area, okay, fine, that problem isn't coming from where you just cut it out. So you have to treat the entire person. So what I explain to my patients who may have had a surgery, or if I will actually send patients for surgery. I mean, there's some patients where it's too far gone and the cost benefit is now weighing in favor of surgery. So I'm not saying that there's never a time or a place. You just want it to be the last resort. So I will tell the patient, listen, you're going to have this procedure. As soon as you're up moving around, you got to get back in, or you're going to have another procedure. Because the reason your L5S1 wore out or your L5, L4, L5 wore out is not because L4 or L5 went rogue and started behaving on their own independently of the rest of your body. That's just not how it works. You have to take into account people's feet, the arch in their feet, the knees, the hips. You have to look at the cervical occipital alignment to the sacrum. I mean, so it all functions as one. There's this fluid system, and everyone loves to say it's all connected, except for when they really have to do the work. Then it's easier to just cut out the spot that hurts, as to realizing, no, it is all connected. Your pelvic floor is weak. You're stiff in your hamstrings. Your glutes your quads are weak. Your glutes are weak. Those are things that matter, but you have to take care of your spine. And if you go in, like, if you went in at 45, to use dentist as your example, like, you had some work and you went in and the dentist is like, oh, this tooth is all decayed, you got a root decay. Would he tell you to just go home and like brush just that tooth? Like, when you're brushing your teeth, just get that one that hurts. Don't worry about the other ones. Don't floss everything around it. Like, so holistic is a generous word to use for the fact that your spine is one thing. No part operates independently of another. So, I've had patients with excruciating low back pain that have cleared when I treated their neck. So if you're not looking at the whole person, then you're piecemealing it. And piecemealing it is profitable because at some point you're pretty much guaranteed if they don't get their function right and they don't get their nervous system free, they will have another issue. And the cycle continues. And it's like, well, I got this disease, my spine continues to wear out. Perhaps you do, but are you doing enough to prevent that from occurring?
One thing I wanted to ask you is when you think about your biomechanical life and the fact that most of us in the Western world were sitting from age 4 until we graduate from high school, and then many of us in work, in car, at home on our computers, sofa, just doing so much sitting, commute to work on the bus. And then there's the right way to sit, there's the right way to stand, there's the right way to sleep. I mentioned some of that in the beginning. So if someone was to come to you at age 40, so that's, coming up on 4 decades of sitting,
Mm-hmm.
if they could show you pictures, a progression of them for their entire life. This is me at age 4, at age 5, and this is me sitting in a school desk. This is me sitting in my desk at home. This is me sitting on the couch at the kitchen table, dining room table. So on the one hand, they can show you pictures of them sitting and also standing. This is me doing a book report at age 8. This is my posture from the side, my posture from the front. We're in a shirt that we can see our hip levels, or we're at a gym class where we're shirtless and we're standing. So they have all of this photographic evidence they could show you from sitting and standing from age 4 until they're 40, and then they come to see you. So that's on the one hand. And then they've got some spine problems and knee problems and what have you. And on the other hand, they're going to show you their x-rays and their MRIs from right now. So you can see
Yeah.
this damage. Is one of these pieces of information and evidence more important? Are they equally important? Or how would you look at that if you had the time to spend 2 hours with this person and put all their pictures up on a PowerPoint, put it up on a grid to show them their levels, et cetera, and then you could go through the MRI as well? Are both of those things of significant importance and what you
They
can
are.
do?
It's insignificance for the patient. Is it significant to me and what I need to do from that point forward in the treatment plan? Not necessarily, because you have to treat the person that exists in front of you currently. And if you have knowledge of what's going on, then you understand the things that have led to this condition. So, which I feel very confident that I do in most cases. So for the patient, it really matters, but you can't turn back time. You have to deal with it going forward. So to your point about the modern society, it's technic. It's technic. Like, that's the thing I see. I got 20-year-olds whose necks look like they're 50. 20 years ago, when I treated a teenager, their neck felt like a teenager's. Now I treat like a 19-year-old's neck, and it feels like a 45, 50-year-old's neck used to feel. And that's sad, right? But that's the way the world works. That's where the
And
information
that's
is coming.
not from trauma playing sports. That's from
That's the other thing.
years of
Yeah,
looking
no,
down
it's from, yeah.
modern lifestyle.
It's the phone, and then if you add that, maybe they play video games to the mix, and you'd be surprised like what that does. So, but I would say, 100 years ago, 80 years ago, we were more industrial. It was low back issues, right? So what I try to explain to my patients is your body is going to basically reap the consequences of whatever life you're living. There is no life that's perfectly balanced in activity, because we all do something throughout the day. So there really is never a point like where you don't have to mind your physical being. Um, what the challenges are now currently, yes, they start younger. There's more stagnation. There's more distortion and curvature from all the I don't really have a sedentary practice. My patients are all type A, very active. The thing I have to tell most of my patients is calm down. You need to rest for a few weeks, which is not at all the case in most places. So that's a different thing. The number one question I get is, can I keep working out? And it's like, well, you might have to take like a week or two at least, right? So that information is valuable. Looking at past imaging is valuable. The one thing and you mentioned it just now, that kind of can, you know, kind of break that whole historical pattern is a trauma, right? So what I tell patients when they're coming in and you said it perfectly. Oh, you could put it up an X-ray at 40, and oh, here's a degenerated C5-6 segment with all this bone spurring around it. So I know that that's been there over a decade. The patient needs to see that to understand it's been there over a decade. A lot of times, like, well, this just hurts. Well, 80% of back pain is insidious, meaning no one really knows why it happened, because it's been a process that we were compensating for, and then it happens. Now, if you fall down a flight of stairs, you know when it started, right? You get hit by a car, those are your exceptions. But that's the minority of people presenting with low back pain. The majority of people presenting with low back pain can't tell you what they did to make it start hurting. But if you dig and start asking them questions about their past and what they've done and what they felt, oh yeah, no, yeah. It's like 10 years it's been hurting when I laid on at night. I just kept going. Well, that was like, that was the signal to do something. So all the data is important. And I do spend a lot of time with my patients, like you said, if you could spend, I do. I make sure the first couple of visits with a patient, I do spend a lot of time. Doctor means teacher. So if you're not, and like I keep using the word liberating, right? If you can teach someone why what's happening to them is happening to them, then fear goes away, then knowledge comes in, and then they're liberated, and they're not living in this and then you're lowering their anxiety, and you're empowering them to make a decision that is ultimately the best for them, and actually the right path, as opposed to a fear-based decision.
So you mentioned turning back the clock, Adam. I think what I wanted to do with my description of looking at their lifestyle of posture, sitting and standing, is to say these are your propensities. these propensities I am still seeing as you walk into my office, as you sit over there. I'm
Hmm.
still seeing those. So we want to be cognizant that if this wasn't a car accident victim, this is a long-standing improper biomechanics and sitting, et cetera, that caused problems for you, compensations, weaknesses in the psoas and hip flexors, lower back pressure in the lower back, not enough curve, which is my problem, not enough curve in the lower back. And so we want to look at these things and make some assessments. We're going to test some things, see what you could change, what you could allow to evolve wellness wise back into your sitting and standing posture, your stretching posture, the way you pick up things like when you're putting on the golf course, the way you pick up the ball and you replace the pin, these types of things. We want to see if we can make some changes and what you're willing to do over time, rather than relapse. If we do a month and a half of training you to live differently, and then you stop coming 3 times a week, to mean you go back out and you forget all that, you go back to your norm, that was kind of a waste of time. So that's what I meant about looking at their history and looking
Right.
at their propensities. Maybe you could speak on that, Dr. Adam.
Yeah, there's you have to get into, the patient's lifestyle, which is also a part of those initial couple visits with me. A lot of patients will have them shift to a standing desk. I have a large Wall Street contingency, so there's a lot of guys looking at multiple screens, working 12 hours a day, especially some of the newer guys who get into the industry, they got to put in some pretty gruesome hours. So, we go over keyboard, computer, all the ergonomics of working, and making sure they don't sit too long. And I have seen the upright desk make a big difference. And then I also show them, exercises to keep going and maintain. So it all factors in. And it's not like, come in, I'm going to treat this, come back, I'll treat it again, because you're not really teaching anyone anything in that level. So it's all important. I will add that even if someone's trying to do everything they can do right, there's still going to be a point where you need someone to come in and do things to you, for you. Like, you could brush and floss your teeth every day and you still may need dental work, right? So so I mean, we're here to help each other. And this is just like a sentimental, emotional aside, because everyone's always looking for like this term biohacking you're hearing all the time. Like, why would you hack your biology? Why not balance it, right? Like, if
Yeah.
I said, oh, I got this like great hack mechanic, he's like great at car hacking. Like, would you want a hack job done, or would you want the car like fixed completely? So and I'm sure you've heard it like, oh, this is biohacking. Like, well, if you're doing everything right, you don't have to hack your biology. You can normalize it and balance it. But that's nomenclature. I get into that stuff. But looking at it, like, you have to treat the whole patient. You have to go through it. But we're here to help each other. And if you get, I don't know how anyone can really get better and get healing in a physical nature without someone touching them. That blows my mind. You also don't have to be a doctor to heal someone. Like, a hug for 3 minutes releases oxytocin and makes someone feel better. Like, we're here to touch each other and to help each other, and in an intimate way, in a physical way, in a caring way, in a nurturing way. And so intention from the person to the person is has been very sterilized, because it works really well for Rockefeller medicine. And it's very profitable. And they've kind of beat it out of our society that just someone putting their hand on something. I mean, I can explain to you neurologically why if someone touches you, you feel better and your pain goes down. That's not like fluff. That's a scientific fact, right? Just like if you smile before you speak, your brain is going to go into a higher state and you're going to speak better. So it all needs to be there. And unfortunately, it's not profitable to push that. So we don't really, we've lost that.
You mentioned, Adam, Rockefeller medicine. Maybe you can speak
Yeah.
where that term, where you found that term and what that's all about.
Well, that term is defined. So back in the early 1900s, Rockefeller, the oil tycoon, as I'm sure you may have known, had some influence. just a little. Rockefeller. So his chemist basically came to him and said, we can make organic molecules from petroleum. And so, what does that mean? It means we can control physiology of the body. We can mimic the body with petroleum and shift physiological actions. So at the
What did he
time,
say he could make?
the organic molecules in petroleum. So basically, this is where pharmaceuticals came in. So and then the Flexner report goes into this. This is what came out of this. So
1930s.
Before earlier, yeah, like 13. I think the Flexner report might have been 1913, but by the 1930s, there was another thing that kind of had emerged, and that was the American Cancer Society, which was a effect of the pharmaceutical industry taking over for the previous 10 years. So basically, what happened is Rockefeller got a great idea. He's a businessman. Okay, well, here's what we're going to do. So at the time, all the medical doctors in the world, basically, but in our country, were practicing naturopathy, herbal medicine, the kind of stuff we're talking about: lifestyle changes, stretching, posture activation, hydration, even positive mindset. I imagine, I'm sure they had to address at some point. Rockefeller basically took over the AMA and said any school that does not prescribe petrochemicals now will no longer be an accredited medical school. So, and then he used his money and his media that he owned to basically send the message out that anyone not prescribing petrochemicals is a quack. And that's where the term quack came from. It was a Rockefeller term to discourage anyone from seeking natural care. So since then, that's been the AMA has been, it's a petrochemical. It was started by Rockefeller. It was never intended to ever heal or cure anything. It was always that we can control the physiology of the body with these petrochemicals, and we'll never actually change the issue at hand, but the petrochemicals will be needed. And then what they found about 10 years after this Flexner report dropped, and they discredited all these schools, and the big smear campaign and all that and the term quack medicine, right, which was coined by them. What they found was about 10 years later, cancer skyrocketed in America. So the next thing, Rockefeller was like, well, let's start the American Cancer Society, and there'll be more profit in a tax-free kind of way. So that is our medical system. Now, not to say everyone who goes into that system has those intentions, like, there's great people in it, but at its top and at its foundation, it was found as a way to keep people dependent on controlling the physiology of their body. So that's Rockefeller medicine. That's what it is. I mean, it's. I would think that should be the alternative.
Yeah, alternative. That's so fascinating. So
That term drives me crazy.
yeah, it's a tough one because you've got a system, and let's call it a box. So the system's in a box. Now, if you're thinking out, if the system is broken, it's in the box and it's broken for the most part, and you're just putting band-aids on things and relieving symptoms and causing more problem, toxicity and things like that over time, or surgeries that were not the appropriate step at that time. And you think outside the box, well, the outside the box would be a better alternative than this broken system. So that's the way I think about alternative medicine.
Right. I mean, everyone's free to do as they choose. But unfortunately, media and it's very influential. People are, if they hear something enough, they believe it to be truth. And I think the people at the top of this are fully aware of that. So, the message got beat into our heads for the last 100 years.
And if you question it too strongly, you'll be deplatformed and disbarred and lose your license.
Exactly. Well, I mean, who came up with the term conspiracy theorist, right? I mean, the CIA. They didn't want people asking questions.
You don't want to believe the government, now you're a conspiracy theorist.
Exactly. So, I mean, you look at who you can't question, and that's probably who you should. So, that's the way it goes on that. But obviously, those are things that I hold real passionate, and I do. I tell my patients this stuff, and they either are like, this guy's insane, or like, oh yeah, it all came together. It makes sense. That's what it appears to be.
There's a gentleman, back to joints. There is a gentleman named Dr. Middaugh, Middaughg, who's a physical therapist down in El Paso, Texas, strongly built guy, kind of like you. And he talks a lot about pressure on the joint. So pressure on the knee leads to joint breakdown, osteoarthritis, pressure in the lower back. He
Right.
talks a lot about pressure. And for therapeutic exercises, he wants functionality, he wants fluid flowing, he wants decreased inflammation, but he doesn't want you for a knee, which historically I saw a lot of this growing and being in high school in the late 70s
Right.
and watching pro athletes do their training. There was a lot of knee extensions, which puts a heck of a lot of pressure, that seated
Yeah.
leg raise thing. And so he's against that. He's against doing lots of heavy squats. He's pro using the core and the glutes for propulsion, for absorption, for
Right.
stability. He doesn't want you to use the quads. He doesn't want you to build up the quads, which he says raises the knee joint and puts pressure on it and makes when you activate it, it can make the knee, the patella hammer against the area where it shouldn't be hammering against. So he doesn't want us to put all this extra tissue on our thigh and do all these quadricep exercises. So over to you for what pressure's relationship to osteoarthritis, and then healing in a depressurized kind of a way, if you're in agreement with Dr. Middaugh's philosophy.
It's funny. I've had the leg extension conversation. Prior to being a chiropractor, I was a strength and conditioning coach with the Kentucky basketball team. So, we would get into these big, like, what's right, what's not. And they had a very intense program. But I just had this conversation, about leg extensions the other day. And I think heavy leg extensions the strain on the knee is bad. I think it's a good exercise if someone is really atrophied and deconditioned. You can start activating the quads, especially in someone who has some other limiting factors where, the open chain exercise is going to be a little more beneficial to them. Maybe they don't have enough stability to start doing closed chain stuff where they're propulsing from their glutes and they have to stabilize. So if you have someone who's got a real bad low back injury and you're trying to get them moving, or if you had someone who had a knee surgery and you need to start activating tissue again. But I think when you start to get into that real hypertrophy stage, which it sounds like the guy you were mentioning was addressing, is that heavy loading. Yeah, pressure on the joint. Pressure makes diamonds. It's what some of the guys in the gym would tell you. It also makes arthritis. So pressure, what I tell patients, I don't use so much pressure because there is a level of pressure that's therapeutic just for bone density, right? So jumping jacks, different things like osteoblast activity is increased with pressure. Sustained pressure, not necessarily, but activation of those tissues. I mean, we need to hit stuff. We need to jump down from a step, activate the bone matrix. So, but that repetitive, isolated motion with constant pressure, yeah, it breaks things down, And I tell patients when they have arthritis in a joint that people think it's like a cold, right? Like, oh, I caught arthritis. Like, I got arthritis. And it's like, it's not like this pathogenic thing. It's a functional issue. It's a result of friction. When joints move freely, they're fine. When joints start jamming and moving and grinding, friction happens, and that osteoblastic activity that I just referred to starts to increase because the body has to protect that area from, and the way I explain it is like, if you got calluses on your hands from lifting, which I certainly do, the reason it's dysplasia, right? Like this tissue type has to change to accommodate the stress you're putting on it. So do you really want to go and start jamming the cartilage in your knee with heavy weight? At some point, that's going to change. It's going to stiffen. It's going to become more rigid to endure all the pressure you're putting on it. And so I do agree with the heavy leg extension thing. It is something some people can get away with and others just can't, once you have but it can be in its proper application. I don't like it done. I like a shortened range of motion on leg extensions. I don't like going to 90, don't go down that far. If you work in that mid 45-degree range, just to start activating, if you're talking about in a therapeutic sense, right? So, but yeah, that's you see it.
What I would say, Dr. Adam, is that who doesn't need joint therapy starting at age 4? I think we all need joint therapy.
Yeah. As the twig is bent, so grows the tree, right? That's what we say. Patients ask me, they're like, hey, what age of patients do you treat? And I always say from the womb to the tomb. I mean, obviously I see a lot of pregnant women and I treat infants. And, and you have to explain it to people like, so your child's 9 and you're going to put braces on them so their teeth are straight when they're an adult, but your child fell down the stairs and you're going to give it Advil and hope that that condition corrects itself. And so your child does not have an Advil deficiency from falling down the stairs. That's certainly not what, like, the stairs didn't suck all the Advil that wasn't in his body already out of it. You know what I mean? Like, there were, so you need a so, and because, or you'll take a look at a patient and there are, they have these genetic predispositions, like really flat feet and different, and that's genetic. I mean, feet our structure is genetic. Our overall expression of health is not genetic, right? Like epigenetics, but your structure is pretty much genetic, what your bone structure and shapes are going to look like. So, I'll tell them like, well, you're dealing with this now. And, oh, your kids play sports. Yeah, all the time. All right, well, what are you doing to prevent your kid from having this problem by the time like, are you, because once you hit 25, you're at skeletal maturity. That's it. You can really influence the youth. And, the only people I see with really great spines got adjusted as a kid, kind of like adults with great teeth got braces as a kid. And it's just so rhetorical, right? But no one's saying it to them. And when you say this to them, they get this look like, oh, oh, like, yeah, gee, you think?
I have been thinking a lot in my, I'm an elder statesman now. Once I hit 60, I got white hair. I became pretty much an elder statesman. So you get a chance to look back at all the learning, all the coaching, all of the medicine people you interacted with. And since I write books on athletes, and I think I've done the longest study ever done on, it's an anecdotal study. I wish I had a major university we could really go at this, but
Right.
I've had discussions now in some official 3-hour interviews with, I'm up over 4,300 high performance athletes. And out of that group, there's also industrial athletes. So contractors, dancers, postal workers, Marines while they're Marines and after they're Marines, anybody using their physical body for their income at that time, high school, college, and pro athletes. So I'm kind of the guy that's done that deep dive on that. And I started that question in 2008. And what I found invariably, and I'm up to 10 people out of 4,300 who've told me that their core group of people post high performance physical activity for, a career in high school, college, pro sports, or Broadway dancing, or general contractor. When they leave that high performance physical activity, only 10 people have told me that their core group of 10 people are greater than, have a group that's not sedentary greater than 10%. 10% and below is the almost 4,300 people say that when they go through their list of people, they see them at the annual golf tournament, they see them at reunions or on Facebook. They are mostly sedentary and not very physically adept. They're overweight or they're frail. Most of it's overweight. Not too many people are frail. And so that's a pretty darn long study. 2008 till now, 10 whopping people have said their core group of people could be 30%, could be 80%, but that's only 10 people out of 4,300. And so the 4,300 I've talked to times 10 equals 43,000 people. That's a pretty darn big study that I've done. Over to you for your thoughts.
No, that's great. What you've noticed is people, when they no longer have to depend on being physically active for their income, and I don't want to just reduce it
or
to
their
that.
high school
Or yeah, just like an
being on a
activity they were
team.
doing it. Right. You think a lot of them let it go is what you've seen.
Yeah.
Wow, that's really surprising. That's surprising.
Guess what the reason is? And this is, I'll give you the Family Feud top three.
The reason, I couldn't tell you because that can't be me. But what was to be the reason? Because I would like to know myself.
So the first reason is they were never wellness-oriented people by programming. So if they were 7, 10, or 15 and they got into that sport, their coach was not wellness oriented. They were high performance oriented. training oriented football teams, watching the tapes of the games. I know a high school coach who's the assistant coach who's got a master's in exercise physiology, and he played pro sports, and he's a very gifted athlete. He's in his late 60s, early 70s now. He was at the team meeting where this younger coach in his 30s, said, we're going to start having evening meetings now. So besides the morning practice of fitness and agility and the afternoon practice, now we're going to be doing tapes and other meetings in the evening a couple times a week. And so this older coach took the younger coach in his 30s aside and said, Coach, he said, is there any chance you think we might be overdoing it with these 3 practices or meetings per day? And the younger coach said, I think the kids can handle it. And the older coach said, just because they can handle it doesn't mean they should have to handle it. Over to you for your thoughts on this.
Yeah, burnout, right? The burnout. I see it a lot. Like another thing, like with I treat a lot of high school athletes. It's a my son is a high school athlete, and it's tough. That's we could do a whole conversation on the level of intensity that should be endured in your teenage years. It's tough. Yeah, I've seen kids. I've seen kids when they finally get that first chance to do nothing because their parents pushed them so hard and their coaches pushed them so hard, they do nothing. They've gone away to college, come back, and their physique is totally changed. And it's like, I had to do all these high school sports. I'm sick of it. I don't want to do it. Now I'm just having fun. See, I've seen that. And that's sad, because what they've done is they've taken a very valuable thing and distorted it because of winning. The desire to win trumped the child's well-being, so that you beat it to death, and now they're, the physical activity to them feels like a labor as opposed to a reward. It's surprising to. I also, obviously, there's a lot of people who are young athletes and stay athletes throughout their life, which I imagine may have been the case with you. So and me, like I don't personally get how anyone can be sedentary. If I can't work out for about a week, I go insane. So, and I've had plenty of injuries and had to not work out for a while. And I'm always like, I don't understand a couple of things, or well, I don't understand quite a few things, but in regards to this conversation, I don't understand not being active is. That blows my mind. I can't really think of. I almost think about it like it's a mental illness, like it should be diagnosed and classified, that you don't, because that means you just don't like to feel good. Like the reward, the psychological benefit, forget aesthetics. Like you're a better person for everyone else when you're active. You're a better father. You're a better husband. You're a better, brother. Just neurologically, what it's doing for you being active. So, but I think what that is just this intense competition that is ruining it for people. And there's times when they're pushing my son too hard, I guess. It's happened. And I've just kind of said, you got to, that's it, not today. This is be a kid, go be a kid, go play with your friends. You did 5 hours of football yesterday, like it's okay, go be a kid. And when you're getting paid millions of dollars to do this, if that's the case, then maybe the guy can tell you, that your Saturday isn't yours anymore. But right now, there's other things like educate, and you see it, and it's like parents fighting at the games. Like what? Like the psychology of childhood sports is gone. I mean, it was pretty intense when I was young, but I mean, it's people have means now there, and there's people profiting off of like, oh, we got these camps. Like, well, you got a camp, he's already in season. Yeah, but we got this extra camp and he can do an extra practice. And it's like an extra practice. He just ran for 2 hours. You want him to go to another 2 hour practice after this? Like, well, we see he's got the talent. And it's like, well, he's not going to have the body if you break it before he's 18, right? So it's tough. It is. It's a tough thing. And a parent who doesn't have much knowledge about sports medicine and physio, the body is, unfortunately, can fall prey to some of these overextension of a child's time. And these I don't want to call them money grabs, because a lot of them are great, but you got to balance it out with what's good for the kid and what they can actually endure.
Yeah, the idea of kids playing and recreating and working out their difference, settling their differences, and getting a program. So if these kids are going to meet at the park regularly, they want to have something that works, so they know, who not to do a cheap shot to, who not to push too hard, who's good at throwing, who's good at catching. And they work everything out on their own with no coaches and with no
Right.
parents. They just do it. And that's how I grew up. I did play a lot of organized sports, including ice hockey as a young guy, but my ice hockey was only two days a week when I was a kid at age 8.
Gotcha.
So that was perfect. And I did free skating, maybe another 1 or 2 days, worked on my stuff, but I wasn't a kid that was going to a personal trainer. I
Right.
wasn't doing 5 or 6
Right.
practices per week. I didn't have team meetings. I was a normal kid in the neighborhood who played multiple sports,
Right.
including fun stuff like frisbee. And that's how you learn recreation, you learn human development, you learn working things out as a group, joy in movement. You get to, I think watching an athlete in motion is more fun than watching a hockey fight. I mean, a hockey fight comes up here and there, but the joy and movement of Gretzky and Bobby Orr and these great movers, it's for an hour and a half you get to watch that. That to me is the fun, not just who wins that game, which is an ego thing. It's watching these great athletes in motion. And if the goon on the other hockey team goes up and he
Mm.
disables Gretzky or Bobby Orr, or whoever the current one is of that group, you've ruined 10 or 15 years of being able to watch that athlete do his thing just because of winning a game, and putting someone out of the game so you can win a game, and ruining part of their life. It doesn't make any sense to me. Over to you for your thoughts on that, Dr. Adam.
Yeah, I mean, competitive juices, they they get going. I mean, obviously within now we're talking about sportsmanship, and that's that's a very dynamic thing, and it should be taught and it should be attained. Yeah, the beauty of movement is, it's why it's a large reason why I'm into what I'm into, and obviously it sounds like something you're very passionate about as well, and I share that. Going back to what you said about the structure, you played right as a kid. Um, Basketball was a big
A lot
sport.
of unstructured
Yeah,
physical
exactly.
activity
I
with
was just gonna
friends.
say, like the unstructured play is gone. Like I grew up street ball, and yeah, I played a ton of basketball. Like that was but I could say that playing basketball on the street is where I actually got my game. Right? Like you did it in organized ball and school ball and this and that, but like the street ball and like my sons, his friends, they get some pickup games going, but most of the stuff is structured. And football kind of has to be structured, obviously, with the safety regards and all that. So I understand that. But a lot of it is all structured and just free play. Like kids, I wouldn't be able to remember you used to drive around a neighborhood and you see kids playing all over the place.
Yeah,
What happened? Where are they?
yeah, yeah, yeah.
No one's playing. Right. And so, they're inside playing online with each other. it's, I don't, it's not good for their metabolic health, and it's also the thing you just said. We're being able to sort differences out, being able to work your way through a bully, being able to show compassion for someone who you knocked over, being able to stand up to the dude who knocked you over. Like it is a microcosm of life, being active and playing as it is something you should go through, and you shouldn't be able to just sit online and interact with a kid, and then as soon as he says something you don't like, you're like, I'm leaving, gone, turn it off. Like, no, you had to get through that. Like, and if that person was in front of you, you would have had to sort that out, whether for bad or good. It still is a life skill that needs to be happening, and you could say a lot of that is happening because of that physical passion, that desire to be physical and to go perform. And what it brings with it is a whole host of sociological interactions that benefit you later on.
So the idea of joy and movement, recreation, development, exercise and recovery. It's another big thing. All of those things you learn intuitively and by sharing with your friends as you, if you grew up in an active lifestyle. You want things that work. You don't want to have a thigh that just feels inflamed all the time because you're doing too much and it's not not recovering properly. So you learn how to rest, how to do therapy, what to eat, how exercise
Yeah.
lightly can, that's is according to the NSCA. When I did my personal training certification, the number one therapy for muscle recovery is doing some light activity in that area. So if your thigh's inflamed and the tissue's not recovering, you do some light squats, or you do maybe a little bit of dancing or cycling or swimming to keep that fluid
Right.
flowing through that area, to keep that tissue bathed. And people need to learn these things, and they can learn them organically. Like when I was a kid, we had Sports Illustrated, and there was a column written by doctors here and there, and there were books in school, and our biology teacher was the wrestling coach. So he showed us some of these things, and we could share in that informational
That's
growth
cool.
organically. We didn't have to go to a doctor to hear that, although it's good if the doctors reinforce that. Over to you, Dr. Adam.
Yeah, that's the a thing that I'm guilty of too is, you said light activity, and you said learn how to rest. That's hard. Like I don't do well with rest. So I sympathize with patients who I tell like, hey, you need to rest. And then I usually follow that with, you're going to do whatever you want to do, but you should rest. We'll get you through it. I do a lot of different techniques to hopefully accommodate, make up for that. But there is no replacing it. That's for sure. But rest is hard. Like if you're an athlete, rest makes me crazy. Like and I got to do better. Like because I've certainly worked myself into places where I need to rest. And some people rest is like they're so good at it. That's not me. So I always envy like guys like, oh, I'm taking a couple weeks off, let rest recover. And I'm like, oh, that's great. Like good for you. Like by the time I've chosen to rest, it's probably I should have rested a while ago. So so that is very important. And what we were just talking about is are we pushing the youth into a situation where they can't accept rest, where they don't know rest, and personality types obviously play into that. Some kids, even if you told them not to rest, are going to rest anyway, and vice versa. So yeah, the light work.
How
Uh,
about taking naps, Dr. Adam?
Phenomenal if you could do it. Like they're great. I'm not great at it myself, but I envy those who can just drop out and take a nap midday, and I think they're phenomenal, right? Because we heal during our REM sleep, right? So the more you're putting through your body, the more sleep you need, and if you really do want to like get big and get strong and speed, you're not necessarily increasing. You can unless you got to have it, but you can tweak it and increase it stronger, faster. Your endurance, like and all that repair is happening during REM sleep, right? So we beat ourselves up at the gym, and then if you don't sleep, you're not really going to gain the rewards of the work you put out during the day. So naps are phenomenal. I wish I was better at taking them.
So how I coach people on taking naps, I say, okay, tomorrow I want you to wake up at 4:40 in the morning and do your fitness program then.
Okay.
And if you do that, and then you fast until, I tell people to fast, and within reason, healthy people, I say intermittent fasting, go as long as you can in the morning, so you really get the hunger pains, and you live off your fat, be fat adapted. It's a wonderful thing. You'll have more energy if you teach your body how to be fat adapted. Your growth hormone goes up, your testosterone goes up, your focus goes up, your excretion, everything improves with that intermittent fasting that I know of. And then wait, and then break your fast, and have a meal, do a little bit more work, or go to sleep shortly after that meal, 20
Mm,
minutes, an hour, whatever you can do, and then get back into work, and you'll get 2 days in one. And 2 days in one is a great way to do it. And your cortisol levels are a lot better, your heart function, your focus, everything's better. And you can sleep better at night because you've had that nap. I believe in teaching people how not to be wired at the end of the day, how to be
right.
tired at the end of
Right.
the day.
Right. Yeah, wired and tired is I'm in the Northeast, the tri-state. It's it's buzzes, man. It's intense. There's not too many other places in the nations I go to where, like if you just go like on a 2-hour drive away from New York City, like You're like, wow,
Yeah.
it's like I could breathe, like it buzzes here, like, and some people visit it and are like, the buzz is so nice. It's like, yeah, well, try it every day. So yeah, the wired and tired. I'll have patients who can't sleep, and then we'll go through what are you doing, right? Because obviously I treat beyond just neck and back pain, a lot of metabolic conditions and sleep, insomnia, anxiety, allergies, all that stuff. When you combine the nutrition, the acupuncture, the chiropractic, so when you're working on that, like oh, I can't fall asleep again. And I've actually had patients like, well, you're too tired to sleep. And like, what do you even mean? I'm like, it takes energy to go into your REM sleep. You're drained. You don't have it. So when you said that you need to like nap in the day to help you get a deeper, yeah, because you got some rest. Like I'll actually have to put people on some herbs that will give them energy so they're strong enough to sleep. And then they're like, "Whoa, this herb might wake me up." It's like, maybe for like 10, 20 minutes when you first take it an hour before bed. But eventually, like rhodiola, ginseng, some of these herbs, people would think like, oh, that's in boosting energy. It is, but you also need it to sleep, right? Because what happens like with recovery, what happens to like if you're doing strength training, how much metabolic recovery is going on during your sleep, right? Where that's where the gains are being made. So no, it's that's a good, I someone recently was telling me what you said, like well, get up at 4 and then by noon you'll be tired and you'll take your nap. If your schedule allows for it, I think that's great. Currently mine doesn't really allow me to shut down midday to nap, but that would be very nice. And I imagine my sleep at night would benefit as well.
There's a gentleman named Dr. Doug McDuff. I think he's in the South somewhere. He wrote Body by Science. Are you familiar with his work?
I've heard of the Body by Science. Yeah.
He's an ER doc. He's an athletically looking guy. He said he wasn't very skilled in a lot of his sports, but he looked at. He's really good at teaching biochemistry. So a lot of the personal training and the athletic contingent uh, flocks to him because he can teach you the biochemistry in a way that's understandable. So good for him. But one of the things he talks about a fair amount is the fact that our quadriceps need recovery. So when we go out and we do heavy squats, we do lunges, we do sprints, we do hill workouts, bleachers, all these types of things, there's a recovery time when to rebuild that tissue and get the inflammation back down. And amazingly enough, even in 20-year-old people, it can take 5 days to get back to complete recovery. That's a long time. So he's not telling everybody just go out and play sports once a week, but he's telling people to be cognizant of that and to not do too much. Don't do thighs, sprinting, and bleachers all in the same day, and don't do anything like that. Don't hit that quadricep hard 3 days in a row. You're going to fall because of dysfunction based on fatigue. So over to you for some thoughts on that, Dr. Adam.
Yeah, I mean, overtraining. It's not just like not eating, not enough, not sleeping enough. I mean, it's the actual activities you're doing. There's that refractory period, in most, physiological balance where the body goes into a repair stage, and yeah, yeah, if going back to my son, there's times where they want him to do a couple things. I'm like, no, you just did that like the other day. You need to give it a few more days before you go do that again. And they're getting better. He's in a good program. So, but some of the strength training stuff, it's like, I don't like it. Like, overtraining is a real thing. And it goes back to rest, like the gain is made during the rest, the damage is done during the activity, and the rebuild is during that resting stage. And the youth accommodates for a lot, right? Like, if you take someone my son's age and have him do legs 2 days in a week, yeah, he's going to say maybe he's a little sore. But you take someone, in their 40s and say, all right, we'll go train legs hard a couple days in a week, within a couple months, that's over. They're not, it's not going to happen. It's-
I, I met an elite former Olympian, top 10 in the world volleyball player in Santa Barbara when he was 33, and he still looked really good. He was still in the top 5 or 10 in the beach volleyball. And I told him about my work on the aging athlete, and I'm looking at people the aging athlete doesn't mean you're old. It means that you're different between age 17, 17 and a half, 18. There's always a different thing going on with your physiology, your mindset, etc., your training, your job schedule, your now dating people. All things are always changing. And I said, I have a question to ask you, because he's a really strongly built dude with really good set of lower limb things with incredible vertical leap. I said, could you at age 33 right now go down to UCLA and do an indoor volleyball workout where they're doing lunges, or they're running bleachers, or they're diving? I mean, that's the hardest thing about volleyball indoors, is diving. And you're 6'6", right? And how agile you're going to be at 6'6", and you're a big, strong guy or gal, and you're diving, and you have to land on your hip, the side of your body, your elbow, your forearm. That's really tough. So I said, could you go and do the UCLA workout
Right.
with these 18 to 22-year-old people in the top of their game? And he said, I could do it, but he said, I would feel the pain much more than they do that day and the day after. And my chance of injuring myself would be pretty high, because I haven't done that type of workout
Right.
in over 10 years. So imagine this elite athlete who can beat those kids in a beach volleyball game, saying he can't go do their workout because it's too deleterious and too difficult.
Right. Right. Yeah. You mentioned, like, one of the things that is great for my business is lunges, like it works.
For most dysfunction,
Greenwich Wellness benefits from lunges, you know what I mean? The patients don't. Lunges is one of those things, man. It is a tricky exercise. No, you walk into any gym and you'll just see, like, a trainer picking up some dumbbells. Oh, I want you to lunge across the gym and lunge up and back. And you're watching, and their glute medius is turned off and the knees internally rotated. And it's just like, oh my God, the sacral, iliac ligaments are just getting mangled. And it's like, there's so many better ways to kind of strengthen your quads and your glutes. And it's a real terrible thing to see, like, someone in their 30s decides to go start working out, and they get this trainer who starts blasting them with plyometrics, like, and they're like, I tore my Achilles. Like, yeah, you think you like, plyometrics, like, end in your 30s. You don't start plyometrics in your 30s, right? Like, and plyometrics are phenomenal, like the gains and the speed of the gains, but it's absurd, But, like, yeah, I will tell patients, like, I can look at a patient and be like, oh, you did lunges? They're like, yeah, how can you tell? I'm like, well, because your pelvis looks like you got tackled by a bull. Like, it's you're doing them wrong, like, so. But yeah, that's I always kind of laugh at that exercise.
last thing, and then we can run. We were supposed to do one on physiology and and wellness and its relationship to intimacy. So I'll send you an email and see if we can schedule that
For
in
sure.
the future. We got into this thing based on my condition of being a standing person today on the
Yeah, yeah,
interview, and
yeah.
not wanting to be a sitting interview host. But the idea of wellness is a big deal. Functionality is a big deal. What I came up with in 2008 for my first website was called maintenanceworkout.com. I'm a big believer, and especially in my era, when we were 18, we were all fit. And the last gym coach, our last day of class in June 1981, this coach had been an elite cross country and track coach. He was an elite athlete in high school and college, strongly built guy, but now he was in his mid 60s and had, bow legs, and he had knee problems. He's still doing a lot of swimming, a lot of walking, a lot of working out. But he told us this thing, we were all 17, 18, about to graduate. He says, look, he said, today's your last day in PE. This is the most functional, the most strong, the most fit you're ever going to be, based on my experience.
Yeah.
He said, now, and I'm getting goosebumps from him telling us, he goes, now I want you to go out and prove me wrong. That
Yeah.
was a big deal. I became better with age besides my current lumbar issues and meniscus tear. I became better with age because I learned more about the body and I did things more efficiently about the body. I learned jujitsu. I learned to become a better swimmer and runner, golfer, everything I worked on as an aging person. And I was able to prove him wrong for a very long time. And I'm still working on it now. And he gave us that gift when we were 17 or 18 over to Adam for his thoughts to wind this down.
Yeah. The being at 17, 18, I think you have a lot of inherent fuel in the tank. But I think you can be a lot stronger at 25 than you are at 18, which we see, right? I mean, myself. I mean, even to relate to your point, like, I've had so many injuries that, basketball, football, soccer, they're not really options for me anymore, but even when it comes to like my strength training, the weight I move, I don't go for weight, but I at 18, I wasn't lifting what I'm lifting now. At 25, yeah, in that area, but so I would have probably proved that guy wrong as well. And certainly if someone ever said that to me at 18, I probably would have tried to prove him wrong and on the spot. So
What a, what a great closing coaching moment for him to come up with that and
yeah,
to
that's
us.
really cool. That's really cool.
He wanted us to be victorious with life, and life to
Yeah,
me is a question of balance, and if I'm a single guy with no kids. If I had a wife and 5 kids, I wouldn't have been able to do the learning that I did, the
yeah,
physicality that I did, the recovery that I did. I mean, I haven't had to wake up at 2 or 4 in the morning to take care of another person very much in my life. I had to do that
yeah.
with my father a few months ago to be a senior caregiver. And I
Mm,
was going from 7 in the morning till sometimes, writing the Google Doc report until 2 in the morning. And now I realized what a lot of parents had to do. It's exhausting and
it's a lot.
it can be debilitating.
Yeah, yeah, it is. Well, because when you're not getting the thing we were talking about, rest, right? So, you're running, the fuel is not infinite, right? And certainly when both my kids were babies, yeah, my workouts were, I was starting a practice, it was I was like what, 10, 12 hours a day, 6 days a week, like, and then, waking up at 3, waking up at 5, waking up it, and yeah, the gym was not as productive. Kids
Do
got
you
older,
have
they
a,
slept through the night, and the workouts got a little better.
is it called boutique medicine or what's the other type of medicine where a clinic can charge people monthly for a certain amount of
Concierge.
concierge? There's the word. Do you do any of that?
I have like what we call, it's not so much a membership, but you could call it a membership. Yeah, we have like a monthly membership type of thing. I'm not an insurance practice, and that's
You
another.
give them the invoice and they can submit it to the
Yeah,
insurance
yeah,
company.
like that's the sick care system. So why would I enter into that arena when they already have numerous? I mean, the AMA the Supreme Court found the AMA guilty of trying to get rid of the chiropractic profession, and
When
they
was
appealed
that?
it 3 times, and it's so why go into an arena where they don't want you anyway, so
What year was that?
the Wilkes case, I think it was it 92? It might have been right around 92 in that area, maybe 86 to between 86 and 92 in that area. Yeah, it was the Wilkes case, Wilkes, and they brought suit. The AMA was found of slandering and trying to, defame the chiropractic profession, and the chiropractors won. The American Medical Association appealed it 3 times, I think, in the Supreme Court ruled in favor that you guys are trying to get rid of chiropractors. So,
Wow.
um,
Wow.
yeah, well, I mean, like quack medicine, right? So, I mean, you spread word, but I guess anyone who believes that is a conspiracy theorist. So,
The doctor who wrote gave me a good testimonial for my book Sedentary Nation and my workout program, the maintenance workout. He said that when he's a sports doctor, he's an orthopedic surgeon, so he's on these traveling teams sometimes. He's been doing that for 30 years. he said the chiropractors can intervene with these athletes immediately. I'm a surgeon. I can test them to see if there's a
Right.
weakness in this area, but the chiropractors can give treatment right then and there that I can't give. So we're both part of this
Right.
group and we're helpful, but I can't do what these chiropractors can do.
Right, you get them right back into play right away. And one of the things, my son has benefited from is having a father who's a chiropractor
Mm.
at his games, and then the other kids are like, wait, how did you do that? I want to go back, because I've like been on the field and adjusted my son, like put his ankle back in and he's back in.
For Miyagi, you
Yeah, I
remember
was
that
just
from the
gonna say
Karate
that.
Kid?
I had it. Yeah, parents are like, "Hey, Miyagi, can you help my kid?" I'm like, "Well, if you sign a release form, maybe." Yeah. So, but yeah, it is. And one of the things that is so pivotal about that early intervention chiropractors provide, like, if an injury sits, what starts to ensue? Fibrosis, right? Inflammation, right? And the body's gone into this, inflammatory response, and it's going to happen. So if you can remove that injury right away, the healing time, like sprained ankles, for example, like, I've had patients like they sprain their ankle. They're like, oh, I didn't come in, I sprained my ankle. I thought it needed to, wait a few. Like, no, the longer you wait, the longer it's going to take to heal, right? Like, and I've had people like sprain, dislocate their ankle and set it right away. And, within a few days, they're up going at it again. So that early intervention that chiropractic
What
provides, and that was really insightful of the surgeon to say that, like, because
what
it's immediate.
what year of your chiropractic education did you learn how to set joints?
Uh, I'm well, you start immediately. I mean, you do over, I think it's almost 4,500 hours of manipulation. So
So it's
you
along with the book learning and the sitting in a class, you're doing hands-on almost
You're
immediately.
hands-on day one, but I mean, you're
Mm.
learning landmarks, anatomy, touching the tissue, learning how to feel what's under the tissue. There's a thing in chiropractic school where they tell you to get like, the New York City, well, I don't even think they exist anymore, phone book and put a hair in it and see how many pages you can go through. Like, oh, it's 100 pages. I feel the hair, like, because they really work on your tactile sensation and your palpation. So you start there and then you start with like, an intense amount of anatomy. I mean, I thought I did anatomy when I was studying physical therapy, and then I went to chiropractic school, and I was like, "Whoa!" Like I didn't know
Mhm.
anything. It is so intense, the anatomy. Like but it's great. It's what you should know. And
I'm going to give you a trivia question. Go finish your thought, and then I'll give you a trivia
yeah,
question.
yeah. Well, hopefully I remember.
So,
So yeah, but yeah, you spend a lot of time, and you spend the time. I have patients ask me, "How'd you learn how to do this?" On my classmates. So you basically, when you go into chiropractic school, you sign your body like a release waiver, and you all end up learning on each other. You have to volunteer your body to science,
mm.
and Fauci would love that. So what, at least these people were consenting. So you go in and you start just you work on each other, not haphazardly. I mean, it's broken down into like every nuance, like to touch, to feel, the move, the setup, way before you're ever thrusting through a joint end range and stuff. So there's a lot of time spent, but there's also a lot of pain in the process. Like I, definitely got hurt a few times. Some of my classmates definitely was like, oh, that was really bad. Like, you come out of chiropractic school, your spine's a little beat up, but it's for the betterment of your community is what I would say.
All right, here's the trivia question. And I learned this and I ask people who know anatomy like you do. So take your right hand up and up here, and without saying anything, touch your cricoid cartilage. Hey, 100%, A plus.
There you go.
I want you to ask some new chiropractors or people in the medical field when they come into your office next time to point to their cricoid cartilage because it's not something that's very well known. When you say,
No, the other thing that's in that area that most people don't even know exists is the thymus gland, which is your immune gland, right? And have you ever
yeah,
heard it
yeah,
ever acknowledged?
no, no, you don't hear that much.
Yeah,
No.
I mean it's only the immune gland, right? So and you know,
Pineal and the dot from the people in India, the pineal gland, the
right,
third eye.
right, right. No, it's great, and it's all the body's amazing.
Something tells me getting hit in football here and boxing
Yeah,
and hockey right in the pineal gland can probably mess us up.
Yeah, fluoride was the least of your issues. It was all those headshots you took. Yeah, totally.
Tell us how to get a hold of you, and if you're working on anything that you're going to be putting out to the public, and how what's going on with that. So tell us how
Yeah,
to get a
thanks,
hold of
Sifu.
you.
So, my practice that has been in Greenwich for 20 years is greenwichwellness.com, spelled like Green Witch, GREENWICH. You can always just, go to the website, contact me there. I also did start a YouTube thing, to kind of get some of this information out there. Some of it from my environment kind of requesting that I do it, and some of, it's called the Massoud Method on YouTube. So that's relatively new. That's up and working, and there should be a Massoud Method website coming soon, and possibly doing telehealth visits for more metabolic conditions, and doing some functional medicine, which I do with, from the nutritional aspect, and helping people deal with metabolic issues. But those would be the good places to find me.
So
Absolutely.
I'm Sifu Slim, author of Sedentary Nation, author of The Aging Athlete, and my third book, which I haven't released yet, but it's been done, is called Raising a Child Athlete, question mark, things you need to know. So of course that's going to be to teach these young people about things like yoga, recreation, wellness, stretching, diet, all these things that will help them with their performance goals now, but will help them with their long life of being balanced people, being agile people, being fit for their entire lives. So that's something I want to bring to the public when the marketing is right. And if people need online coaching, just go to sifuslim.com and you can find out how I operate and ways to interact with me. Any last thoughts before we say goodbye to this podcast?
No, thank you so much for having me on. It was a real pleasure. I appreciate the time. I hope to speak with you again in the future.
I,
And
I, I tend to find good people, Adam, and so I'm blessed. I had no idea that I was going to land on the research person that I landed on, but in the first sentence we shared, I could tell you had that background just by the way you speak.
Oh, I appreciate it. Thank you. Yeah, it's good to find out more about what you do as well.
All right, brother. Aloha, and audience, please give us a thumbs up and a like, and we'll talk to you in the next video. Aloha.
All right. Thanks, Sifu.